The network was established in 1997 with the support of the Directing Council of the Pan-American Health Organization. And this gives us an important mandate within the region of the Americas to work together to produce technical documents that are thereafter considered by the executive branch of the network and thereafter adopted by the conference. So it's an important opportunity, I think, for the countries to come together every 2 or 3 years to review these documents, to review the work of the working groups, and to thereafter internalize the processes, internalize the documents and incorporate them within national laws and regulations relating to pharmaceutical products and health technologies. That's true. I think many of the countries have improved in the last 14 to 15 years, and this is closely linked with the economic development of the region. Nonetheless, there are countries that are more well-resourced, other countries that are less well-resourced, and so there will be a certain degree of asymmetry in the regulatory capacity for medicines and biological products within the region of the Americas. And I think for that reason that these kind of forums in which the regulatory authorities can come together to talk, to discuss normative aspects and to look at regulatory capacity and work together in exchange mechanisms really is a mechanism to bridge those asymmetries, and so the larger countries and the more well-resourced countries can help the smaller or less well-resourced countries. Been working very well with Anvisa over the last 13 years since its creation through the establishment of agreements, technical cooperation agreements, and we've had the pleasure to accompany Anvisa and to see it go from strength to strength during that time. We think that this is very important because Anvisa for us is now considered a national regulatory authority of reference for the region of the Americas. And that's not just simply a recognition given by the organization. It's a recognition that's the fruit of a process, a long process, whereby we've looked at the functions, the structure, and the legal basis of the agency. And based on that, consider it is really an agency that has enormous capacity to provide the necessary regulatory capacity that it needs to ensure quality, safety and efficacy of medicines in the country. But also for us, this recognition is important in the sense that it provides a framework for international cooperation between Anvisa, PAHO and other countries. For example, we have 27 national regulatory authorities here at present. And I think one of the most important calls coming out from the conference already is to strengthen international cooperation. And I think Anvisa will be an important partner in that. I think, yeah, we can certainly identify one single theme that is coming out from the conference, and is very well related to the theme, the actual overall theme of the conference itself, which is strengthening national regulatory authorities within health systems. During the last 5 or 6 years, and really since the establishment of the network has focused very much on the development of technical guidelines. But I think there is a recognition now within the network that we need to link the development of these technical guidelines, which are very important and have been very useful for the countries, with some mechanism to actually strengthen the regulatory capacity of the actual national regulatory authorities. And so this is really the issue that's coming to the fore in this conference. How do we actually establish the bridge between the normative development of the network with the processes that we need to develop to strengthen the regulatory capacity of the countries?